Good morning, everyone. Today we have Professor Sudhir Kumar with us. So he'll be talking about ankle and foot joints.
Ankle and foot form a very important segment of the lower limbs. There are about 26 bones and 33 joints and roughly around more than 100 ligaments that we have in the ankle and foot with tendons and muscles. And it's said that we take roughly around 10,000 steps per day. And foot roughly bears about 3 to 4 times the body weight while running and walking. And patient may present to you with a single pathology or multiple pathologies. The most important aspect that the patient present to you is with pain. The pain in the foot or in the ankle could be a diffuse pain or a localized pain. So whenever there is a diffuse pain, we'll have to find out if there is any correlation between the various segments in the foot. So if the patient presents to you with mainly the pain that is coming up in the anterior part of the ankle joint, then this could be because of either a degenerative disease or it could be because of any injury, a sports injury that could occur in plantar flexion of the ankle. The patient may have the medial pain, which he points out below the medial malleolus. And in these situations, the patient could be having either a subtalar problem or a tarsal coalition. Patient could also have a pain on the posteromedial aspect, which reflects possibly the pain right in the coming out from the tibialis posterior tendon or a tendinopathy. The patient could present to you with a pain on the left side, on the lateral aspect of the ankle, and that could be anything like a stress pain right onto the fibula or to a ligamentous injury in that region in the lateral complex, ligamentous complex. Patient could also have pain on the posterior aspect, and that could be because of either a retrocalcaneal bursitis or any other inflammatory change that is occurring onto the calcaneal tuberosity.
So location of pain is very important.
Oh, extremely important. And these patients could also present with diffuse pain, which is, or it could present with the localized pain. And this pain also could be, your next point is to ask about whether the pain is radiating down onto the toes, or the duration of the pain, how long this pain has been persisting, and whether this pain has a diurnal variation. In that itself will tell you whether the patient has any inflammatory change or the pain is also present at rest. He can have a pain at rest, which could be because of any other conditions like tumorous conditions, where it could be throbbing in nature, it could be because of infection or acute infection, and there could be certain aggravating factors like if he walks on it, then he starts getting pain. That indicates possibly he's been either having a stress fracture, or at times it can also be because of ganglion, which could result in a compartment syndrome right onto the foot, in the forefoot region. So it's important to ask your patient whether he has been doing any activities which he has not been used to, that could result in a stress pain, stress fractures, that could result in stress fractures. So what could be the relieving factor at rest? If he gets no pain around, at rest, then possibly it is a
red flag.
It's sometimes a red flag signs. Okay. So the pain presentation is an important modality to be asked from your patient. Okay? And next, what you should be asking your patient is swelling.
So next point we need to talk about is deformity.
Deformity can be of very acute presentation or could be slowly progressing. In acute presentation, say you get a deformity which is suddenly developed because of any injury. The injury can give rise to acute deformities, where it can take a shape of either it has injured the ligaments, in which the foot may go into inversion. If the usual injury is on the lateral border of the foot, or the deformity could be of a very chronic duration, which could be in infective conditions, a slow-growing insidious onset of infection, like in tuberculosis. The ankle could have a deformity, or the foot as a whole could have a deformity. So whether this deformity was progressing or not is another feature which need to be noticed. In a deformity which is occurred in a childhood, which could be in children, which could be because of any spastic condition in which the deformity keeps on increasing, or maybe because of paralytic condition where the deformity keeps on gradually increasing, or because of any injury where you find the deformity keeps on increasing as a child keeps on bearing weight on the foot. While in certain chronic conditions like inflammatory conditions, there is acute exacerbations and remissions, where the joints involved could leave behind a deformity, and this deformity becomes progressive as the time passes. The deformity could be also painless or painful in conditions where you have recurrent infections, and you develop an ulcer. And this could be a painful deformity. And you could also have a deformity which occurs because of Charcot joints, where to start with you may have a pain, which later on, as the disease advances, it becomes absolutely a painless, deformed joint. We have to also look at the shoe of the patient. If the shoe has been showing more of a wear on the outer side or a wear on the medial side, gives us an indication of whether the foot is going into more of a valgus or a varus situation.